So hello everyone, it's National Careers Week and I wanted to make a pledge for National Careers Week to tell you a little bit perhaps about my own career in the NHS and why it matters so much to me. So it starts with, actually, I didn't grow up in England, I grew up in Malaysia, where when I was a teenager, I started to learn about, altruism and helping others, and felt very fortunate about my own privilege. And one of the things I learned about was about the National Health Service, and it was at the time when I was also interested in a career in medicine. And I was really struck by this concept of healthcare for all, free at the point of delivery. To me, that was like the height of a sophisticated and civilized society. And here I am, so many years later, actually part of this enormous NHS family, and I couldn't be more proud to be part of it. I went through a very traditional route of going to university, medical school, and then my career progression was really set, as it often is with many doctors. But I was very fortunate to have mentors and to have kind of sponsors, if you like, people who sort of thought that I could perhaps do something a bit different. And those people were very different from me. They were, older, white, middle-class men, very different from me. But they often spotted something that they wanted to help me develop, even at a time when I didn't really think that this was an area that I could go into, management and leadership. But it was with their support and encouragement, and sometimes they were quite pushy and challenging when I felt that it wasn't something that I could do or I should do. Here I am, all those years later, in HEE. And I am absolutely thrilled that I have had this opportunity and that people believed in me enough to push me in this direction. I'm really I'm a service user of health and care services. I will be someone who will need support and help as I get older. I have friends and family who have benefited so much from what the NHS and other care services do for them and all of us. So it's a really proud thing to be part of this movement, and I really do believe it's a movement. So I talk to sometimes my friends, think about, secondary school age young person, especially now. It's a most rewarding career. And the best thing about it is the people, the patients, your colleagues, and the communities that you get to engage with. It's really, really rich and enriching to be involved in something that puts you in touch with the kind of human condition every single day.